Thank you, Mike. I appreciate it, and it's a privilege for me to be here this afternoon back in Florence County, and especially at the Florence County Health Department. If I can, Senator Leatherman, I'd like to take one aside, since this is your ceremony, and just say one thing to the DHEC staff, because I think that's important. During these very difficult times, I think the agency has been served so well by its commissioner. He has served so well over the last 8 years and some of the most difficult times that this agency has ever gone through. And my predecessors certainly had nothing to go to like you have, and I think that a word of thanks needs to be said to you for the job you've done and the leadership skills you've demonstrated. And I mean that from the bottom of my heart. I appreciate your work, man. I got to know Senator Leatherman in 1986 when I first had the opportunity to go to the State House and represent DHEC before the General Assembly. Senator Leatherman was a member of the Budget Subcommittee that oversaw not only DHEC's budgets, but all of the budgets of all the health agencies in the state of South Carolina. And it was a real opportunity for me to have the chance to get to know him. And he taught me a whole lot of things. You know, John Wooden, the famous coach, has just recently passed, and his players came forward and said, "This is what you taught me," or "This is what he taught me." Well, I remember three things very distinctly that Senator Leatherman always said during those meetings when we talked about programs and budget items, and they were three P's. First of all, is it right for the people of the state of South Carolina? That was it. That was the first question. Is it the right thing to do for the people of South Carolina? Second, is it prevention-oriented? And for everybody in this room with drug and alcohol, with health departments and others, I mean, that's talking right down our alley, because it was the right thing to do because it saved taxpayer monies, and it also saved people's human suffering on down the line. The third thing it taught me was I better be prepared when I walked in the room. That was the third P. Because it's already been mentioned here, Senator Leatherman does not spend taxpayers' money lightly. He takes it, he looks at it as if it belonged to him, because it belongs to all of us. And he always wanted to know, is it going to meet those three criteria? Is it going to prevent suffering? Is it going to prevent further expenditures in the future? And is it going to be the right thing for the people in the state of South Carolina? As long as I did those things right, then I really didn't have any problem. Because Senator Leatherman is not one of those legislators who shakes your hand, slaps you on the back, and listens to you for 3 minutes and says, "Oh yeah, we'll do that," and you may never hear from him again. He gets in the details. He knows what goes on. And I can tell you, if you're not prepared when you go into that conversation, you're going to be a very embarrassed person because you need to be able to answer those questions. If you look back from today to 1985, all of the public health advances that have been made in the state of South Carolina, before that time, very little was said about HIV/AIDS. Very little was said about solid waste and how do we handle that in the state. Very little was said about how can we save money by immunizing our children in the state. Every one of those things I just mentioned, Senator Hugh Leatherman has his stamp on, his leadership as a part of for the people of South Carolina. Very, very few people can make that statement that they were there and that they made those kinds of significant contributions. Earl mentioned the word statesman. In a day of and time of people who represent a district and look and say, well, that's good for my district, that's all I care about. Senator Leatherman is interested in Florence and Darlington and the PD, but he is truly a statesman who looks out and says, Is it better for Greenville County? Is it better for all the county and all the people of the state of South Carolina? And that really does take a statesman to be able to do that. You have a flyer today that outlines, and I won't take time to repeat what is in that flyer, but Senator Leatherman's efforts on the behalf of children just this past year on issues, especially children of special needs, has been exemplary, as it has been throughout the years. His work in keeping the Medicaid program going and having it strong in the state has been essential for those who do not have a voice in the lobby at the State House. So he is a statesman. He is a person who works on the behalf of all the citizens of this state. And I can tell you, in my opinion, there is absolutely no one in the state of South Carolina more deserving than this recognition from the South Carolina Public Health Association than Hugh Leatherman. Senator Leatherman, congratulations, and thank you for your service to our state. I'm going to present this to you, but I'd like to give you the chance to make some remarks, please.
Doug, thank you. Thank you all for coming this afternoon. What a great day for us. You know, I really am honored and humbled to receive a prestigious award like this. Not often we get an opportunity to do that. Before I go any further, I think it's fitting to take a moment to thank the entire health community for all of your contributions. Every person in this room who's involved in the health care of our citizens, thank you for what you do. You know, that includes the doctors, the nurses, surgeons, health professions all across our state play a very vital role in creating promoting a healthy South Carolina. That's what you're about, and I applaud you for that, and I thank you for that. Thank the South Carolina Public Health Association, Lily Hall, Mike Chappell, and the entire leadership and members for all that you do. The work your association is doing to protect and promote personal, community, and environmental health is to be emulated, and we hope that will be emulated throughout this state. I have no doubt in saying that the members of the association, you do an incredible job in fulfilling your mission. Again, thank you for that. This is a mission that has helped foster the health care growth and continuity we see today in our health care system. And think back a few years, 5, 10, couple of decades, we didn't have the continuity in our healthcare system we have today. You know, as foreign teams, we know the impact of the health community can play in our Busman region. I see Rob Coloni's here along with his people. Think about what a tremendous asset our hospital system in South Carolina is to the entire area. I recall when McLeod moved to where they are down here, left the old McLeod Infirmary up there, so I guess I'm telling my age now. It goes back a lot of years, but I tell you what, that was a tremendous step forward for our citizens when this took place. We've been very fortunate in the growth and expansion of medical facilities here in the PD, McLeod, Carolinas, Health South, all of the ones that's out there providing health care for our system. And quite often I get asked, Senator, did you know we got a third hospital in Florence? I said, we do. And they said, yeah. They call it Regency, I believe, Rob, is what they call the Regency Hospital. And I guess they're actually operating out of the old Carolinas down there. So, and I didn't know that. I was called to task for that. Said, you're supposed to know this. And that was a couple of years ago, so I promise you I have not forgotten that. Really honored to be and thrilled to be accepting this award this evening. And I tell you what, I will try my best to live up to doing for the people of our state what this award is all about. That's helping to care for our people